It's no secret, February is one of the most difficult months of the year, and a lot of people use the term seasonal depression to describe how they're feeling right now.
Yeah, but for some, it could be a lot more serious than just that. And knowing how to navigate the situation is so important when it comes to someone's mental health.
Resiliency expert Dr. Debbie Gilboa joins us now. Dr. G, how do we make sure that we're looking out for friends and loved ones, even ourselves, while honoring their privacy and dealing with this tough topic?
So what I want us to think about is not to be afraid to ask, but just to be a little bit thoughtful about how we ask. If you decide, you know what, everybody who is important to me, I'm going to check in on, then you're not trying to decide, is it okay? Should I or shouldn't I? We should. We now know really clearly, both from research and anecdotally, that feeling seen, having someone ask, can actually prevent the things we're most worried about, the risky behaviors that can come out of real struggle with mental health or with mental distress. So we're going to ask. Then the questions are just when and how and in what way will this be heard or received the best by the person that we're asking.
Yeah. And in fact, so once you take that step, I mean, what steps can you take to then help that person that's struggling? Because I feel like, physical health is one thing, and when it comes to mental health, for whatever reason, there's more of a stigma attached to it. Like, it's harder for people to admit they're having a problem.
Absolutely there is. And there's a sense that if I were just stronger, less lazy, more educated or something, I wouldn't feel this way. And that's absolutely not the truth. This is as chemical as diabetes or asthma or anything else that if a friend had that, you would say, hey, I'm worried about you. What do you need? And people would feel less concerned to say, hey, I need some help with medicine or treatment or support. So the first thing I want you to think about is if you really don't know how to bring this up with someone, talk about yourself, not your own struggles, but what you've noticed about them. So use what are called I statements and say something like, David, I've been feeling like we're not connecting as well recently, or I've noticed that your appetite seems different than it was, or I've noticed that you're not as smiley as you have been at other times. Now, telling people to smile is not the right answer, but noticing your observations out loud to them is a really great way to put it on yourself and not have anyone feel like it's some sort of accusation or charge against them.
Right. Really smart.
There's this huge topic of toxic positivity, and I think this is so timely too to tie into this, that people are pushing like, well, you just have to have a better outlook, or you could just see it in a more positive light, or just change your thinking and you'll be okay. And that is absolutely the wrong thing to be saying to people, because as you mentioned, this is chemical. This isn't just, okay, today's going to be a good day.
Yes, this isn't just a decision at all. Like asthma and diabetes, what you do impacts your health, and what you reach out for or how you approach it or your commitment to your treatment plan, all of those things play a role. But first, you need someone to come alongside you. Nobody telling you how to feel has ever worked in the history of time. Heather, just relax, or you should be happy. Those things don't work. That's telling someone, oh, your feelings are dumb. You should have different ones. So instead, what we can do is say, I hear you. And you matter to me, so I care about what you're going through. That's a way of showing empathy without ever having to say, I understand, or I agree, or I endorse how you're feeling. Just, you matter, so I care about what you're going through. When you say, David, how can we help people? It's important for us to remember that the best way usually we can help is by noticing and expressing that care, because you can't fix someone else's mental distress any more than you can fix someone else's asthma by wanting to.
Right.
Yeah. But
encouraging them, asking, that's all really valuable. Saying, hey, I've heard that there are resources for this. Would it be helpful to you if we looked together? That's all really helpful. But the most important thing is committing to checking in and noticing out loud what you see.
Yeah, reaching out and really good questions. Dr. G, that was fantastic. So thank you. I think it's going to help a lot of people.
We have to talk about it like we talk about having a headache, honestly.
Exactly. Yeah.
Thank you, Dr. G.
All right, we learned a lot. All right, Dr. Debbie Gilboa is a resiliency expert, author, family physician, and regular contributor right here on PTL.